Thanks everyone for joining us. November's Quest for Quality will be on TeamSTEPPS. I think some of you may have heard some chatter around your departments or in your areas about what TeamSTEPPS is, when it's going to be rolled out, things like that. So the purpose of this presentation is to give you some information on where TeamSTEPPS came about, what it's expected to do, some success stories that other places have seen, and kind of the reasoning behind why TeamSTEPPS exists. So before we begin, let me go ahead and give you the disclosures. TeamSTEPPS was developed and is owned by the Agency for Healthcare Research and Quality, AHRQ, and the Department of Defense. I'm not compensated by AHRQ or the Department of Defense for making this presentation, and the scenarios that I present are fictional. I've made them up. Okay? So I don't want any emails later saying you didn't say that right. And for the RNs in the room, for successful completion and to receive CE credit, you must sign the roster, attend the entire program, complete and submit the evaluation that's going to be handed out at the end, and the certificate of completion will be delivered to you by education. Okay? So these are the things that we'll cover. We'll start off with a brief exercise, and then we'll talk about the 3 core principles of TeamSTEPPS, the 4 components of TeamSTEPPS, what TeamSTEPPS implementation looks like. We have some from data, some success stories from other hospitals, what we expect TeamSTEPPS to look like when it comes to HEV, and the implementation timeline. And then we'll do a brief review, and then we'll open up for any questions that you may have. So first, the exercise. What I'll do is I'll present 3 scenarios to you, and what I want is some feedback on how you would expect to change your behavior in response to the scenarios that you hear. Okay? So imagine that you've just gotten off work and you're at home and you've got a bunch of PTO time left over. So you've decided that you're going to book, for the first time, you're going to book a cruise. Okay? You're on your computer, you're looking through dates and deals, and you've got the TV that's going in the background, and it just so happens that there's a news story that comes on TV, and it's about cruises. Okay? This news story tells you that the U.S. Department for Tourism is looking at a case where a passenger on a cruise ship somehow ended up off board and drowned during the cruise. What impact would that information have on your decision to go on a cruise, if any? Seeing people shake their heads, no?
Not use that cruise line.
Not use that cruise line, okay. But it wouldn't impact your decision to go on the cruise. You may just make plans some other way, right? Okay. Now imagine that same scenario. You're there at your computer again, but this time the news story that comes on tells you that an entire cruise ship sank and everyone on board was killed. Does that have any impact on your decision to go on that cruise? Yeah?
I don't want to go on that one.
Okay. So what I'm hearing is that you guys would still consider going on the cruise, but you would probably stay away from that cruise liner, right? You'd avoid that company at all costs. Now, what if you were presenting the exact same scenario? You're back at your computer, but this time the tourism department tells you that they've just done a study and they found out that 39 cruise ships sink every year, kill everyone on board. That's 1 every 9 days. You think you'll fly?
Yeah.
Okay.
Make it a 3-day cruise.
3-day cruise. Very good. So why do you think you would adjust your behavior? Why do you think you would adjust your behavior in response to this? You're telling me that you would, but why would you? Risk, right? We're not willing to accept this level of risk when going on a vacation, right? And just to give you the numbers behind it, if this were to happen again, like I said, this is made up. A normal cruise ship will hold about 2,500 people. And if 39 sink every year, you're looking at 97,500 people dying every year on vacation. Okay? And so the point here is, why is this relevant? Okay, how does it relate to healthcare, and what does it have to do with TeamSTEPPS? In 1999, the Institute of Medicine published a paper called "To Err is Human." And in that paper, they revealed that 98,000 people die each year as a result of preventable medical errors. 500 more than one cruise ship sinking every 9 days. Right? And it's tough to conceptualize what 98,000 people looks like until you take it out of the healthcare context, put it into a tourism context. You can tell how big that number really is. In 2001, the National Defense and Authorization Act was passed, which mandated that the Department of Defense, their military health systems, implement a patient safety program. Okay? So they started doing a lot of research, going back on research that had already been done to incorporate things. And then in 2006, TeamSTEPPS was implemented. TeamSTEPPS stands for Teams, Strategies, and Tools to Enhance Performance and Patient Safety. And it's based in over 20 years of research. Okay, so we all know that there are mistakes that are made in every department. Okay, I want you guys to give me some feedback on characteristics of people that you think make mistakes. The people that you know make mistakes, what are their characteristics? Fired. Tired. Okay. Okay. That may be the result. Yes, they're tired, overworked, short-staffed. Okay. Rushed. Okay. Their education may be not there. Yeah, their skills. Okay. There may not be any framework for them to succeed in. Okay. Right. So some of the overconfident. Okay. They think they know how to do something, but they don't have the skills or the experience to do it. Right. So some of this research is up here now. Even highly skilled and highly motivated professionals are making mistakes. It's not just people that are lacking the education, lacking the training, that are overconfident or overworked. Even highly skilled professionals are making mistakes. Okay. Teams that communicate effectively and back each other up reduce the potential for error. That was one of the findings as a result of this research. And intuitively that makes sense. If you communicate better, if you know that the people that are around you are there to support you, they'll look out for you, you'll make fewer mistakes. Right? So it sounds simple on its face that if you just communicate better, you'll have better results. So why is TeamSTEPPS around? If communication is the answer, why is TeamSTEPPS such a big program developed nationally here to help us communicate? The Joint Commission chimed in on this. Communication failure is the leading root cause of sentinel events over the last 10 years. Right? It seems simple just to talk to one another, but we know that from research over the last 10 years, sentinel events are resulting from poor communication. Three core principles of TeamSTEPPS. And this, again, makes pretty good intuitive sense. For better outcomes, we need better information. Better information will come from teams exercising effective communication. And communicating effectively within a team requires training and practice. It's a skill. It has to be repeated and has to be refined over time. Okay? And TeamSTEPPS is built on four main components. And you'll learn more about that as you go through your specific trainings through your department. The first one is leadership. The role of leadership is to direct the activities, to coordinate, to motivate the staff, and to facilitate the performance. They want you to excel, and they have to give you the structure within which to do that. Okay? The next piece is situational monitoring. In situational monitoring, you're continually scanning your surroundings. You're monitoring your performance and the performance of people that are around you, because that has impact on how well you can do your work. And you have to have an awareness of things that are outside of just your direct control. Okay. The next piece is mutual support. Now, if you think of somebody that you think supports you, normally they would have many of these characteristics as someone that would support you at work. It would be somebody that's able to anticipate your needs. It would be somebody that would help you redistribute your workload if you found yourself with more work than the rest of the people that are around you. And someone that would help you stay balanced. Okay? So you would eliminate the situation in which you're finding yourself overworked while your coworkers have a lot of time on their hands. And the fourth piece is communication. This is where you're exchanging information. This is where you're making sure that you're not just heard, but that you're understood. So you have repeat backs that we do with patients, but how often do we do that with our coworkers? right? We're being heard, but we may not be understood. So all four of these pieces, leadership, situational monitoring, mutual support, and communications, those are the four complementary components of TeamSTEPPS. And these four pieces are used together to influence three things: performance, knowledge, and attitudes. Okay? The leadership is responsible for driving performance. They'll incentivize you, they'll motivate you to achieve these results. With a combination of situational monitoring and mutual support, when you know that the people that are around you are looking out for hazards that are not just their own, but things that also impact you, and you know that when they do, that they'll step in and help, that'll affect your attitude and the attitude of people that are around you. The combination of communication and mutual support yields better knowledge. So when you know that the people that are around you are there to help, and that they'll speak up when they need to share some information with you that you may not have in your care, that'll contribute to your knowledge and the knowledge of the people that are around you as well. The next thing is TeamSTEPPS implementation, and it's broken down in three phases. The first is assessment, then planning, training, and implementation, and the third piece is sustainment. In the assessment phase, we'll have people that'll come through your departments and just kind of see how you operate. How well do you communicate? How well do you share your concerns? When concerns are shared with you, do you take action or do you just blow them off? Right. So in the assessment phase is when they try to find out how well you're performing before TeamSTEPPS comes in. And in that time, they'll identify opportunities for improvement. They'll identify leaders in the department. They may be informal leaders that have influence on some of the work that's done there. In the planning, training, and implementation phase, they take the information that's been gathered from the assessment and they build an action plan. They identify those things that worked well and they try to reinforce those. They identify things that didn't work well and find a way to support those to bring them up to par. Okay? Then the last piece is sustainment. After TeamSTEPPS gets here and it's implemented, how do we make sure that it stays? Because it doesn't make sense to invest so much time, energy, and resources into something that won't last. So in the sustainment phase, you anticipate change. We know that we're going to have new employees that come in that have to be trained. We know that we'll have more resources and different resources available as time goes on, so we have to accommodate for those. We'll have to monitor how well TeamSTEPPS is being used and then step in when it's not. And then we'll refine the program based on all of those things. The next is the impact that we expect it to have here at HEB. We expect it to improve communication. We expect it to reduce errors, decrease length of stay, increase employee satisfaction, and the most important thing is improve patient safety. And all of these sound great in a presentation and on a slide, but you really have to have research that supports that this is what we expect to happen. And we have that in the form of results that other facilities have seen after implementing TeamSTEPPS. And these are those. Improved communication, reduced rate of adverse drug events from 30 to 18 per 1,000 patient days. Cut it almost in half. A 50% decrease in the mean ICU length of stay from 2.2 days to 1.1 days. That's big for patients. Increased administration of properly timed prophylactic antibiotics prior to incision from 84% to 95%. Here's some more. Increased pre-op deep vein thrombosis prophylaxis prior to induction from 92% to 100%. Pre-op briefs, and those cards that you may have laying at your tables kind of discusses what a brief is, revealed 7 patients, 3.3%, with previously unidentified severe surgical risks. And once they were identified, the surgery was canceled to avoid those risks. And 16% reduction in nurse turnover rate. So there's no reason to think that HEB can't achieve these results, and there's no reason to think that HEB can't surpass these results. So I think we have the people in place to do that. What to expect and by when. HEB is committed to fully implementing TeamSTEPPS campus-wide by the middle of 2012. And every department will receive training and education as they become ready to do so. Every department will be expected to integrate TeamSTEPPS tools into its daily practices, and then will monitor usage and fallouts through patient safety observers and SALTs. So we've covered a lot of things today, and we've covered it pretty quickly. I'd like to go ahead and review what we've covered, and then we'll open it up for some questions. So the 3 core principles of TeamSTEPPS are, which of those first 2 is a principle of TeamSTEPPS? A. For better communication, we need better information. Between the second 2, better information will come from teams exercising effective communication, or better information will come from teams exercising regularly. C. Communicating effectively within a team requires testing and planning, or communicating effectively within a team requires training and practice. F.
I just want to argue for the better for exercising regularly.
Yes. It wouldn't hurt. Yeah, I agree. It wouldn't hurt. The steps of successful TeamSTEPPS implementation are, there's 3 steps, and so 2 of those don't belong. A, D, and E. Do we agree? And B and C should go? Yep. Okay. The 4 major components of TeamSTEPPS that make it effective in healthcare organizations are, okay, so B and D should go? Yes? The last one. According to the Institute of Medicine's 1999 publication, "The Error is Human," how many patients die each year as a result of preventable medical errors? Did I hear C from someone? Awesome. It's D. Okay. So we've gone over a lot of information. We've reviewed it. So I'd like to open it up for any questions that you might have now.
What will the department-specific training entail? Because I think a lot of us have gone to the 4-hour, or some people have gone to a full day or a 2-day course. But when we start training departments, a lot of people, how long do we see that training take? Is it going to be 4 hours?
It may be 4 hours. We don't know yet. We have communication from corporate that if the steps of successful TeamSTEPPS implementation are, there's 3 steps, and so 2 of those don't belong. A, D, and E. Do we agree? And B and C should go? Yep. Okay. The 4 major components of TeamSTEPPS that make it effective in healthcare organizations are, okay, so B and D should go? Yes? The last one. According to the Institute of Medicine's 1999 publication, "The Error is Human," how many patients die each year as a result of preventable medical errors? Did I hear C from someone? Awesome. It's D. Okay. So we've gone over a lot of information.